Hey folks, how are you doing? Good to connect with you today. Thank you every time tuning in. I really appreciate. Thank you so much. And as you know, I'm your mental health clinician, Dr. Debbie. I'm a doctoral prepared psychiatric nurse practitioner, and I'm based in United States. And I practice. I see patients, consult, prescribe. Um, Counsel, give therapy, and on this platform is about mental health educational literacy. So I do all my practices, being licensed in the state of New York in United States and the state of Maryland, also in the United States. And just like it is part of a scope of my practice, to educate the populace about mental health so that our world can be safe, we can be happy together. Like in recent times, it's been on the increase that active shooting, which is really sad, which is terrible in different places, especially in this United States or in other places too, where they do not have access to such weapons. We see a lot of violence and aggression and destruction of lives, which some of them, after findings, is related to mental health concerns. And that is why it is important that I think mental health literacy, mental health education, so that we can know how to play our own part, our own role, no matter how small it is. It's going to go a long way to help the people and keep our community safe and keep all of us safe and happy. And the topic of our discussion today is about support to overcome negative attitude about mental illness. It's been a long topic about stigma that people shy away from discussion about mental health, mental illness, mental disorder. People don't want to talk about it, and at times when people can have this condition for many years, for a long time, we call it prolonged duration of undiagnosed mental illness, and it gets to some level that the brain, which I said is the vital organ, has said that we have as human, is out of control, is not able to checkmate things, coordinate again, and things get out of hand, and people are not able to control their behavior, attitude, their thoughts, and at times is always a tragedy. It ends on tragedy. So, but we can play our part, as I said. And there's a movie that is very vital, especially I love it. I've watched that movie, many times, and read even some like a documentary book, about it. And yeah, when I was in my postgrad school. So it is the title of the movie or the book. You can even Google it. It's on Wikipedia, and is on the social media. If you just Google it online on different web. And the title of the movie or book is A Beautiful Mind. It's a great movie about a math genius. Yeah, the name of the professor physician is actually John Nash. In that movie, who overcame serious mental illness of schizophrenia and was able to win a Nobel Prize in economic science. You can't believe it. Yeah, like you need to watch that movie, and wow, you see that the support of mental illness, this thing will have limited this individual, even though it was a severe serious mental aspect of mental illness that this individual struggled with in that movie. But with the support, he was able to scale through in life. It was not easy, starting from getting to college, very brilliant, very smart in science, in mathematics, for that matter. But unfortunately, continued to have episode, and eventually before he got diagnosis, because the people around him did not shy away. They were supportive, the colleagues, the professors, and all that. Several times, getting on admission, it was a lot of like emotional, like emotional pain, before people get to know, because in those years, the knowledge of mental health, mental illness was not as like open or everywhere like now. So they access that, and eventually when they got to know that this is it, they gave the support, the compassion, the empathy that he needed. Several times I said he got admitted, and when they figure it out that it was schizophrenia, yeah, people were really supportive of him. And as I said, when we are compassionate, when we change our negative attitude about mental illness, that's, we encourage people that, oh, it's okay, because many a times it's not the fault of the people. And we're going to be going this series, causes of mental illness, mental health disorders. At times it's genetic, at times it's due to maybe accident, at times it's due to during infection in pregnancy, accidents, in child infections during childhood, even some accidents as well, during childbirth. A lot of things that happen, yeah, our exposure, to some viral infection either during pregnancy or during childhood, or maybe some toxins, some chemicals, like smoking, drinking, illicit drug in pregnancy is going to affect that baby, and it's not the fault of that baby. At times, relationship as human, and we're going to be talking as well about relationship that divorce, separation, it's really tamper, with the developing brain of children, from childhood, when their parents are separated, when their parents are divorced, and they have to be shuttling the kids between dad, between mom, stepfather, stepmother. It's a lot of trauma to these children, which uh, place, a kind of injury, insult to their brain as they are growing up, and they grow up with it, eventually developing mental illness. So, but if we support them, they're able to seek help. It is okay to seek help, from appropriate certified licensed mental health professionals, physicians, and then they will do the referral, to the appropriate professional. Because mental illness is just like physical illness. Nobody is being shamed for getting help for diabetes. Nobody is being shamed for getting help for high blood pressure. No one shamed anyone, even for the treatment of cancer. So it's just like any other illness too, because in fact this is the vital part of our body, like our brain. I always say it is the most important organ that we have in the system. So when the brain is sick or having challenge, why are we putting judgment? Why are we labeling the people instead of coming around supporting them, remove the stigma? Yeah, and it's not transferable by any means that, oh, because I live close to this person, because I help this individual. No, it's not a transmitted like infectious diseases that can be transmitted, like during the time of COVID, that or viral infections and all that. No, this can only be transmitted via genetics or all other factors that we'll be talking about, as times goes on, if you continue to get connected to this channel. So helping one another, because we don't know who it may be, like a lot of people that have lost their life because of an incident of mental illness, that someone just become an active shooter. You don't know. And that is it with mental illness. You don't know the thought that is going through the mind of any individual. Somebody may be sitting down quiet by your side, or walking by your side, or your next door neighbor, or the person that is driving by your side. You don't know what is going on in their mind. So it is important to give that support, to give that encouragement, to give that empathy, so that they can seek help on time, so that they don't live with this illness, until it is completely out of hand. And it is when they become destructive that, we are now, all in the tragedy. And then no one, should lose their life, to mental health aggression or outbursts or violence, if we do our part. There's a way we can, call for help. We can let them know. A lot of people, they don't even know. and then you in a way that you know you can that oh, you've been getting irritable lately. Is everything okay? Are you okay? Are you fine? Is everything going on with you? Is there any way I can be of help? Yeah, I see that you are not looking happy. And many, if you ask genuinely, you know, in with empathy, with compassion, people will own up to you, because many times people are looking for help. It's just that, you know, they're afraid because of the stigma, because of the negative attitude, that they don't want to take the step, you know, to seek, yeah, for help. So with the support of people, you know, people are able to recover nicely. You don't know, all the people that you are working with in the office, they do not put it on their forehead. Your classmates, yeah, your boss, a lot of people in high places, people that you know, walk past them every morning, you sit together, you don't know, and you don't know the day they are going to explode if you don't give them that atmosphere for them to seek help, that they are not going to be labeled, they are not going to be judged. They can easily take permission from work. I have an appointment today, and if you get to know that it's mental health that they've gone for, you are not going to be labeling them, you are not going to be shaming them, you are not going to be judging them. I hope, yeah, it's high time. I want it, as I said, to watch that movie, The Beautiful Mind, and you will see the impact of the community, the support, you know, and it will make our environment to be safe. It will make our all of us to be happy together. I hope you learned something. It's me, your mental health clinician. Mental health should not hinder anyone. Mental health should not stop anyone, because like some of us, we've taken interest, and along the line, I'm going to be sharing my story. It's because of the recovery of a patient. You know, when I was at the early year of my career, that I never knew that, you know, there could be such transformation like this children, this patient that was out of reality. And by the time I saw the patient months later after getting treatment, I couldn't believe it, that it's the same patient. The patient was introducing himself to me, and that is why I went into mental health profession, into psychiatry, and I've been with it now for years. And every time I get that fulfillment, the impact I made in people's life, you know, that they can live the purpose, you know, a purposeful life, they can live a meaningful life, and they can live their life and be happy, and you know, they are safe, and we are not afraid of one another. We live in a safe and happy community. I hope you learned something. It's me, your mental clinician, Dr. Debbie. Check my bio to connect, to learn more. And until I come your way again, stay safe, and thank you for your attention. Bye.